I'm at South Melbourne Market this morning, and Melbourne shoppers are on alert as new exposure sites are added to the list. The source of the Delta strain, the top priority for officials. I now want to bring in GP and AMA President Dr. Tony Bartoni to talk about a couple of issues this morning re COVID-19. Tony, great to see you. What happens if we don't find this source of the Delta strain?
Good morning, Beck. Look, this source of the Delta strain is obviously a concern at the moment. And really what we need everyone to do is to, if they've got any symptoms, get tested so we can clearly understand if there are any other cases out there that are linked to this, or indeed identify the index case to how this came about. It's been postulated that the most likely source for this is, unfortunately, potentially another leak through hotel quarantine. But we do need to try and identify as much as we can. But it could be, just like we saw in New South Wales last month, that that case, we may never find the origin to it. But that depends on everyone getting tested, even for the slightest symptoms. If you're in any of those exposure sites, we need to know as much as possible about this so that we can really be very comfortable as we approach that lifting of our lockdown restrictions.
Tony, a hot topic in Melbourne this week has been QR codes, the implementation of the system and the use of this system. Now, I'm at South Melbourne Market this morning. There are plenty of signs around here asking people to check in. Anecdotally, I've really only seen about 50% of visitors to the South Melbourne Market checking in. We did have a lag in putting together a uniform system for the state of Victoria. That's probably contributed to this. But how important is it that people check in using QR codes?
If we look at this current lockdown and the one last year, one of the key differences is that a lot of the people that are coming up testing positive are already in quarantine. By being ahead of the game, so to speak, we've been much more comfortable in limiting that spread. It's when we were not identifying them quickly enough. And the key to all of that is obviously having a very effective and a very simple to use QR code so that people can check in. The fact that some people are still finding it cumbersome or indeed difficult or indeed trying to not check in at all is a concern, and really a simple, very effective and very safe uniform process, as in other states, is really been one of the key things that have helped us along in this current phase. But clearly more and more people need to do the right thing and check in where possible.
Yeah, I mean, look, I've used it a few times yesterday and today. The app is not cumbersome, it's pretty easy, but I do worry about people, and there are a percentage of people that don't have smartphones, so I'm not quite sure what they're actually supposed to do. I want to talk to you about the vaccine. Strike while the iron's hot, Tony?
Most definitely, Beck. If we just go back even just 3 weeks ago, it was clear that in many of the centres there were more staff than people wanting to receive the vaccine. That's clearly flipped around on its head in the last week or two, and we've clearly seen queues sometimes stretching for hours at vaccination centres. In general practice, we're booked out now for many weeks, indeed maybe even a month or more in terms of vaccination appointments. In general practice, we're doing something like about 500,000 plus vaccines a week now for COVID, and that compares with a flu vaccination rate of up to 1 million last year per week at some stages. So we can clearly do more, but we've ramped it up. Fear has unfortunately been one of the key driving factors in this current demand period. While we've got that demand, let's get as many people in the community vaccinated as supply will allow, so that we can indeed protect ourselves much more efficiently and effectively as we go deeper into the year and indeed into the face of any other further outbreaks that unfortunately we know all too well will come back.
Okay, we'll leave it there this morning. Always great advice. Thank you very much for your time, Dr. Tony Bartoni.